Mammosite is a new technique to treat breast cancer. It allows us to treat only a very limited portion of the breast instead of treating the whole breast. Conventional radiation therapy to the breast treats the entire breast or what's left after the surgeon removes the lump with a margin of normal tissue. Mammosite allows us to just treat that limited area where the mass was removed. This is a catheter with this balloon that is not inflated right now at the end. And so the surgeon basically takes out the area of abnormality in the breast, and you have a cavity left in the breast, and they put this balloon inside the cavity. And this part is coming out of the patient, sticking out of their skin. And then we basically attach this catheter. It'll fill with fluid. Basically, this balloon will be inside the cavity in the patient's breast. This part will be sticking out of the skin, and then we can put in more or less fluid with this. The radiation source comes in through this part of the catheter and goes into that center part of the balloon and just stays in there in the patient for a few minutes and comes out. And this device stays in the patient for a total of 5 days. And twice a day they come in and the radiation source goes in, comes out, they go home, they come back 6 hours later, they do the same thing, and they're done in 5 days. And then at the end of treatment, we take all the fluid out, we pull this catheter out of the patient, and they're finished. So it's an easy technique for the patient to go through, and we have them on antibiotics throughout the course of treatment because whenever you have anything sticking out of the skin, there's some risk of infection. But this way, it only treats that tissue right around where that balloon is, and you're not treating any more tissue, any more breast tissue. In many patients, we need to treat the entire breast. I mean, we don't have an option. But in selected patients, it's just a new technique that can get the whole process over with quicker and limit the radiation dose and therefore limit the side effects.